All right, we're going to go ahead and get started. Hello, everyone, and welcome to today's Provider Education Network webinar. I am Deontay Bayham, the Provider Engagement Specialist here at Wellhead, Louisiana. Thank you so much for joining us today. Today's webinar will focus on the Louisiana State Loan Repayment Program. And before we get started with our presentation, I am happy to introduce today's webinar speakers. Our first speaker is Dormira Perry. Ms. Perry serves as the Primary Care Officer for Louisiana. Her role focuses on improving access to primary health care in rural and underserved areas in Louisiana. Our next speaker for today is Nicole Corsi, who serves as the Manager over the Division of Population Health here at Wellhead, Louisiana. In this position, she also oversees the Louisiana Primary Care Office, where she served as the PCO manager for about 2 years. I will now hand it over to our speakers.
Thank you, Deontay. By the end of this presentation, you will have discovered the background and purpose of the Louisiana State Loan Repayment Program, learned about the eligibility requirements, gain an understanding of the application and scoring process, and we will also share some information about an online recruitment and retention tool that we utilize. Let's start with the background and purpose of the State Loan Repayment Program. Through the Health Resources and Services Administration, the Federal State Loan Repayment Program grants were established in 1987. All 50 states are eligible to apply for the SLRP funds. The grant awards to states range from $50,000 to $1 million. Louisiana has been awarded $359,550 with a one-to-one match by Louisiana with non-federal funds. Administration of the program, the Louisiana Department of Health, Office of Public Health, Primary Care Office, or PCO, is responsible for administering the Louisiana State Loan Repayment Program. The purpose of the State Loan Repayment Program is to increase the availability of primary health care in health professional shortage areas by assisting in the repayment of educational loans. Physicians and dentists who participate in this program can receive up to $30,000 annually for a 3-year commitment, and other professionals up to $15,000. So now let's discuss the eligibility requirements. Eligible healthcare professionals include physicians such as a family or general practice, internal medicine, obstetrics, gynecology, and pediatrics, general psychiatry, general and pediatric dentistry, nurse practitioner, certified nurse midwife, physician assistant, registered dental hygienist, health service psychologist, clinical and counseling, licensed clinical social worker, psychiatric nurse specialist, licensed professional counselor, marriage and family therapist, alcohol and substance abuse counselors, licensed, credentialed, certified by their state of practice that meet education requirements and master's degree requirement for addressing opioid abuse. To be eligible, the participant must work in a federally designated health professional shortage area, which I will discuss in a few moments, work for a public or nonprofit private entity, work 40 hours per week, 32 in an outpatient setting, accept assignments of Medicare and Medicaid, have a sliding fee scale for low income or uninsured patients, be a United States citizen or national, be licensed to practice in Louisiana, have no other obligation for health professional services, have not defaulted on educational loans without addressing the default, have not breached a health professional service contract. Nicole will now discuss what a health professional shortage area is.
Thank you. Now, a health professional shortage area is a designation given to an area that is considered underserved by health providers compared to the population. Simply put, there's not enough healthcare providers in the area to serve that particular population. Now, the Louisiana Primary Care Office makes the initial determination with final approval made by the Federal Office of Shortage Designation in the Health Resources and Service Administration located in Rockville, Maryland. They take into consideration a facility's outpatient census, waiting times, patients' residents in housing to facility, to evaluate the facility's designation eligibility. And each type of designation has a little bit different of a criteria that you'll see a few slides away. Now, several assistance programs use Hipsa designations as a requirement when approving grants and or other funding, such as the State Loan Repayment Program, the J-1 Visa Waiver Program, National Health Service Corps Scholarship and Loan Repayment Program, and then also the 10% bonus Medicare incentive program. Now, I want you to look at this map. This is a map of all of the primary care Hipsa designations in Louisiana. As you can see, 62 out of the 64 parishes in Louisiana have at least part of that parish, if not all, designated as a primary care Hipsa. So when we say primary care Hipsa, this pertains to an area's access to physicians that practice principally in one of the following. It could be a family practice, general practice, internal medicine, pediatrics, and OBGYN. The ratio that's used to measure the level of primary care access is 3,500 to 1. So that's primary care physicians full-time is usually required. So again, for every 3,500 citizens, that means that there's only one healthcare professional for those citizens. Now, this is the dental Hipsa map, and dental designations are designated on a similar ratio scheme. Dental FTEs are calculated by starting with the number of hours of patient care worked per week by the dentist. And then it's weighted according to the dentist's age and number of dental assistants and hygienists that the dentist employs. So on this map, you can clearly see that the majority of Louisiana has a healthcare shortage in the area of dental services. This means that there's not enough dentists in these areas, which means that the population there are not receiving adequate dental care. Now, this final map is the mental health designation map. And looking at the number of psychiatrists is what we use to calculate an area's mental health ratio. The ratio for this particular designation is 30,000 to 1. And from this map, you can see that 100% of our state is either a geographic or a low-income Hipsa designation. Now, I want to remind you again of the purpose of the Louisiana State Loan Repayment Program is to increase the availability of primary care in these Hipsa designated areas by assisting in the repayment of these educational loans. This is a recruitment tool to get health professionals to serve in these underserved areas and a retention tool to keep healthcare professionals in these areas. By increasing the number of healthcare professionals, we can reduce the number of health professional shortage areas. Now, if selected, SLRP will repay governmental or commercial educational loans obtained by practitioners. Physicians and dentists can receive up to $30,000 annually for a 3-year initial commitment. Other professionals can receive up to $15,000 annually for a 3-year initial commitment. Participants who complete their original commitment and remain in an eligible site in a Hipsa designation and still have educational loans to repay, they can apply for an extension of another 2 years to continue their work and to continue receiving loan repayment. Now, loan repayments are not taxable by the Louisiana state income tax. You would serve as we would enter into a contract with you. You would receive a 1099 to file with federal taxes, but are also given a tax code to exempt it. So there's no taxes that are paid. All funds must then be applied directly to your educational debt. Now, currently there are 47 participants in the state loan repayment program. The application period, it opened on April 1st, and we hope to support another 10 to 15 healthcare professionals. At this point, I want to reiterate that this is a competitive application. Typically, we receive anywhere from 30 to 50 applications, but we can only support 10 to 15 with the funding that we have. So now I want to go through the application scoring process. Now, we have put together guidance, and all of the forms are online. We've included checklists to help you put together a competitive application, and I highly recommend that you read the guidance documents, review all the forms, and have everything you need before applying. In the slide deck, we have included links to our main webpage where all of this information is located. And there's also a link to the actual online application. I'm going to pull up the website real quick and show you what the website looks like and where to find all of this information. Again, I want to strongly encourage you to read over the guidance document and make sure that you have all the documents that you need handy before you apply. This is the website with all of the information that you will need to apply. There's some background history about the SLURP program. We go over the eligibility requirements, and then we actually discussed in detail what you need to apply. Here's the application agreement, site service agreement. We even provide a checklist for you. And all of these links right here will link you to that form or document that you will need to complete. We try to make it as user-friendly as possible. And again, the application itself is online. So the link we have right here for you is the link to go apply online. You can submit the form hard copy. You can mail it into your application packet into us, but it is a lot easier on you and on us if you try to submit it online. Now, here are the items in your checklist. I want to go over a few of these items with you. So you need to make sure that you provide a copy of your executed employment contract with the facility. Of course, we need your resume or your CV. You will need a copy of your professional Louisiana license. You will have to submit that, your loan balance information, and there are several forms that either you or your facility will need to complete. And your facility, I believe, will have to sign off on one of these forms. So again, make sure that you have all of your documents straight, all of your documents ready to go when you get online to submit your application. You must provide a copy of the facility's sliding fee scale, the discount policy, the actual schedule, and a photo where that policy is posted in the lobby. Remember, this is a requirement to participate in the program. Your facility must offer a sliding fee scale, discount policy, and it must be clearly posted in the lobby. You must also share a photo of a sign posted in the lobby that states something to the effect of, "We accept all patients regardless of their ability to pay." You must complete a W-9. And finally, proof of a site's nonprofit or public status. We must know if you're nonprofit or the facility is a public facility. Now, we score each application according to priority areas determined by the grant we received. Each priority has a point scale. For example, the first priority is given to applicants who work in facilities with the highest percentage of underserved patients, including those who have Medicaid managed health plans and Medicare, those who are uninsured and indigent or underinsured and unable to find treatment. So the point scale for this particular priority is if the percent of Medicaid patients seen at the primary site is 50% or higher, 2 points. If the percent of Medicaid patients at the primary site is between 15% and 49%, 1 point. If the percent of Medicare patients at the primary site is 50% or higher, 2 points. And same thing with Medicare, 15% to 49%, 1 point. And finally, if the percent of uninsured or indigent or underinsured at the primary site is 15% or higher, there's another point. So you can see that we have established a point system based on each one of these priorities. The next priority is given to individuals who agree to serve in Hipsas with the highest degree of shortage, rural, and those whose service will have the greatest impact on the underserved population. In these high needs parishes, we also have point values associated with each. Priority is given to applicants who agree to treat targeted populations who are designated as underserved in their service area, such as migrant farm workers, homelessness. Priority is given to individuals who agree to accept referrals and provide health care services to a significant portion of at least 25% HIV/AIDS patient based. Priority is given to providers working in a facility with opioid treatment services. In the event that the selection is narrowed down to multiple applicants with the same score, we do have criteria that we use to make that final selection. But again, remember these priority areas when you're completing your application. Now, we want you to hear from a current SLRP recipient. Candace Leach, she is a family nurse practitioner in Jonesboro, Louisiana. And I want you to hear from her what it's like to be a state loan repayment recipient.
High blood pressure affects 40% of Louisiana residents. Healthcare access lets them control their blood pressure until the next big game.
My name is Candace Leach, and I am rural.
The State Loan Repayment Program repays student loans for healthcare providers who choose to work where patients are most underserved. Many kinds of healthcare workers can apply for this competitive funding.
Using the State Loan Repayment Program is a great way to pay off my student loan debt while also helping the community. The application process was easy. Everything was online. It was easy to do, and I'm working in a clinic that I love. I am serving people who might not otherwise have access to healthcare.
For more about the State Loan Repayment Program, visit wellaheadla.com/IamRural.
Now, all you have to do is apply. Again, the application period is open now, and we will be accepting applications through June. So please start collecting your documents. If you have any questions or any complications while you're going through the application process, please feel free to reach out to our office. We are happy to help you through this process.
All right, thank you, Nicole and Dormira. We will now open up the floor for questions. Please type your questions in the Q&A box located at the bottom of the screen. I'm going to give it another couple of seconds just to see if we have any questions that come through. All right, it looks like we have no questions, but please keep in mind that you can reach out to us through our contact information provided on the screen. Please feel free to contact any of the speakers or Well Ahead directly with any questions you may have pertaining to the State Loan Repayment Program. I would like to thank you all again for joining us today. Please visit www.walpen.org to find out more information about our programs and resources. You can also stay tuned for our bi-weekly newsletters with any updates on trainings, resources, and other opportunities that come available. Thank you again for joining us today and for helping us move Louisiana's health forward.